Hey everyone, and welcome. Look, if you're gearing up for the NCLEX or ATI, you already know pediatric infections are a huge deal. So today, we're going to cut right to the chase. We'll break down the absolute need-to-know info, the signs, the symptoms, the priority actions, all the stuff that's going to help you nail those questions on exam day. All right, so here's how we're going to tackle this. First up, why kids get sick in the first place. Then we'll get into your nursing playbook, what you actually do. After that, we'll battle some bacteria, look at viruses and vectors, and touch on parasites. And finally, we'll put it all together. Sound good? Let's get into it. Okay, first things first. Section 1. Why kids get sick. So let's really get into the foundation here. Why are little ones, especially babies, so prone to getting infections? Well, it all comes down to their unique physiology. It really boils down to a couple of key things. First off, their immune systems are, well, just not fully cooked yet. They're still learning how to fight things off. And then there's this really important piece. They get passive immunity from mom, right? But that starts to fade away around 2 to 3 months of age. This creates this window of vulnerability before their own immune system really kicks in and vaccinations can do their job. Okay, this right here is basically the roadmap for any infection. You've got to know these 4 stages. For your exams, you really want to zoom in on that prodrome stage. Why? Because that's the tricky part. It's when you get those super vague symptoms. The kid is just a little fussy, maybe a low-grade fever, just not themselves. It's your very first hint that something's not right, that something is starting to brew. And this, the chain of infection. Honestly, our whole job as nurses is to be chain breakers. Every single one of these links is a place where we can intervene. Think about it. When you wash your hands, what are you doing? You're breaking the mode of transmission. Giving antibiotics? Bam, you're hitting the infectious agent. Vaccinations? You're making that susceptible host a whole lot stronger. So for the NCLEX, you should always be asking yourself, okay, with this nursing action, which link in the chain am I targeting? All right, let's get practical. Section 2, your nursing playbook. This is our essential toolkit, the stuff we use to assess and intervene every single day. Okay, this is a huge one for your exams. You have to know the difference. Standard precautions, that's your tier 1. That's what you do for everybody, no exceptions. You just assume everyone's potentially infectious. But the second you know or even suspect a specific bug is involved, you've got to level up. That's tier 2, transmission-based precautions. And yeah, you absolutely have to know which diseases are airborne, droplet, or contact. That's classic NCLEX territory. Think of these labs as your detective tools. They're the clues that help you figure out what's going on. The CBC, that tells you if the body's army, the white blood cells, is being called to action. The ESR and CRP, those are your inflammation flags. They're screaming, hey, something's wrong here. And the culture and sensitivity, well, that's the gold standard. It's like getting the mugshot of the bad guy and finding out exactly which weapon, which antibiotic is going to take it down. Okay, pop quiz time. The key word here is a protein made by the liver during acute inflammation. Which test are we talking about? And the answer is C, C-reactive protein. Now, this is a classic NCLEX-style distinction. Both ESR and CRP tell you about inflammation, for sure. But the key difference, the thing they want you to know, is that CRP is that specific protein made by the liver, and it's a marker for the acute phase. That's the detail that matters. Okay, let's move on. Section 3, battling bacteria. Now we're going to take everything we just talked about and apply it to some of the heavy hitters. For each of these, we'll hit the big 3, path, signs and symptoms, and your priority actions as a nurse. First up, diphtheria. If you see this word on your exam, I want one word to flash in your brain in big neon letters, airway. The absolute hallmark of this disease is that nasty gray pseudomembrane that builds up in the back of the throat. It's a literal suffocation risk. So your number one job, your only job really, is obsessive respiratory monitoring. This thing can close off their airway and fast. Next, pertussis, aka whooping cough. Now, the buzzword you have to latch onto here is paroxysmal coughing spells. And these aren't just little coughs. We're talking violent, uncontrollable fits where the child just can't get any air in. It's terrifying. And for tiny infants, especially those under 3 months, this is incredibly dangerous. They are absolutely at the highest risk for severe complications or even death. So, what do we do about it? Well, with pertussis, it's all about managing those thick, sticky secretions to keep that airway open. We put them in a high humidity environment to help loosen things up. We suction and suction frequently to get that gunk out. Obviously, you're on droplet precautions, And because these kids can just stop breathing, they can have apneic spells. Continuous observation isn't just a good idea, it's non-negotiable. Okay, let's talk about tetanus. And I need you to shift your thinking here. This isn't just an infection. It's a full-blown neurological emergency. See, it's not the bacteria that's the real villain. It's the incredibly potent neurotoxin it pumps out. That toxin is what causes the hallmark signs: intense, painful muscle spasms. So what does this look like? The number one thing you need to burn into your memory for tetanus is lockjaw. They call it trismus. That cramping of the jaw is the classic sign. Combine that with a stiff neck and those awful muscle spasms, and you've got the telltale triad. Sometimes it's so severe, you'll see opisthotonos. That's when their back arches so intensely it looks like they're being bent backwards. All right, let's put it to the test. You've got a 4-year-old who comes in with a headache, muscle spasms, a stiff neck, and, here's the kicker, clamping of the jaw. You see that cluster of symptoms? What are you thinking? You got it. It's tetanus. And see, that's what the NCLEX is all about. It's about pattern recognition. When you see that specific combo of neurosymptoms, especially the jaw clamping, that's your brain's cue to shout, tetanus. All right, let's shift gears a bit. Section 4, viruses and vectors. So now we're talking about illnesses that are spread by things like ticks. And for these, you've really got to pay attention to the details. When it comes to diseases from vectors like ticks, a lot of the time, the rash tells the story. I mean, look at this. Both are from ticks, but the rashes couldn't be more different. For Lyme disease, you're looking for that unmistakable bullseye rash. For Rocky Mountain spotted fever, it's a totally different look, a small, pink, spotted rash that famously starts out on the wrists and ankles. It's simple. You know the rash, you know the disease. And this is huge for patient teaching, right? You have to tell parents how to do this correctly. You grab fine-tipped tweezers, get right down to the skin as close as you possibly can. And then here's the key. Pull straight up with steady, even pressure. What you don't do is twist or jerk it. Why? Because you risk breaking off the head or the mouth parts under the skin, and that's just asking for more trouble. All right, section 5. We're not going to do a super deep dive on parasites today, but I want to give you a huge exam tip. When you see things like lice or pinworms on the NCLEX, the question is almost always about patient and family teaching. For lice, think don't share combs, brushes, hats. For pinworms, it's all about hand washing, hand washing, hand washing to stop the spread of those eggs. It always comes back to breaking that chain of infection. Okay, here we go. Section 6, putting it all together. We've covered a ton of ground, right? From why kids are so vulnerable, to our nursing playbook, to the nitty-gritty on bacteria and tick-borne illnesses. So now let's do one final challenge to really test your clinical thinking. So think about this scenario. A 6-year-old with a fever, a stiff neck, and here's your big clue: a recent puncture wound from a rusty nail. What is your priority? Well, you've already connected the dots, haven't you? The puncture wound, the stiff neck. It's all screaming tetanus. So your priority isn't just to identify it, it's to act. You're immediately thinking about protecting that airway, keeping the room dark and quiet to minimize stimuli that could trigger spasms, and getting ready for the doctor to order tetanus immune globulin and antibiotics. And that right there, that ability to connect the history to the symptoms to your priority actions, that's not just how you pass your exams, that's how you become a great nurse.